Timely and effective treatment of gonorrhea currently poses a burden to clinicians in the United States. Gonorrhea is the second most common sexually transmitted infection, or STI, in the U.S., with over 600,000 cases reported per year. It also continues to grow in prevalence, seeing a 56% increase since 2015. As case numbers rise, so too do the challenges of treatment. More than half of all gonorrhea infections are estimated to be antibiotic resistant, and treatment guidelines are regularly adjusted and revised to align with the latest science and most up-to-date recommendations based on this rapidly shifting disease landscape. For clinicians who are regularly treating a range of infectious diseases in addition to gonorrhea, staying informed with the most recent scientific literature and current treatment guidelines on gonorrhea is not always feasible or realistic. However, timely and effective interventions adhering to the most up-to-date guidelines remain critical in the treatment of gonorrhea. One method for ensuring that clinicians have immediate access to the best available guidance that takes their specific patient's needs into account is via clinical decision support tools. Clinical decision support, or CDS, describes the process of serving clinicians, clinic staff, and others with targeted patient-specific information and guidance at key steps where clinical decisions are made to improve health and health care. For example, a clinician working in an electronic health record system, or EHR, where clinical decision support is enabled, may be offered a prompt to prescribe a specific dosage of medication based on the patient's weight. The Public Health Informatics Institute, or PHII, with funding through a cooperative agreement with the CDC, has launched a multi-project initiative called STI Connect, which aims to drive better health through data. Building off the foundations of two prior EHR-specific projects, STI Connect is launching a clinical decision support pilot to design and test a standards-based and EHR-agnostic solution that provides clinicians with up-to-date gonorrhea treatment recommendations. PHII is coordinating this effort in collaboration with CDC for treatment guidelines and other partners for technical expertise. We are currently seeking clinical partners to pilot this scalable and sustainable solution. The clinical decision support solution will use the HL7 standard CDS hooks to generate automated clinical decision support at the time of care that can also accommodate agile updates as treatment guidelines evolve. As the clinical decision support solution is standards-based, it could be scaled for rapid expansion by taking advantage of existing standards. Clinical pilot sites have the opportunity to inform the design and test the clinical decision support solution to ensure frontline clinicians and staff have the information they need to support gonorrhea treatment. Clinical input will help to ensure the piloted solution integrates with existing clinical EHRs and aligns with the pilot site's clinical workflow. The STI Connect pilot project aims to ensure evolving treatment guidelines are communicated to the people who need them most to provide the best care for their patients and help combat the spread of antibiotic-resistant gonorrhea. Clinical pilot sites have the opportunity to inform this solution and be on the front lines of implementing this cutting-edge treatment support tool. PHII is currently seeking clinics with high rates of STIs to work with us on this one-year pilot. To contact us or learn more, please visit phii.org/STI Connect.